learners, welcome once again to another MOOCs lecture of BP 103T. We are dealing with Unit 5 Introduction to Semisolid Dosage Form, and today we are going to understand the semisolid dosage form in a deeper way. I am Anjali Mishra, Assistant Professor at Noida Institute of Engineering and Technology, Pharmacy Institute, Greater Noida. So, let us start with today's lecture. So, before moving on to types of semisolid dosage form, we should understand that what is a semisolid dosage form and what are the different classes of semisolid dosage form. So, if I say semisolid dosage form, so semisolid dosage form means any sort of dosage form which is either not in solid state or entirely not in the liquid state. It is somewhere that is present between the consistency of solid medicament and liquid medicament. So, that is nothing but your semi-solid dosage form. So, let us understand how many types of semi-solid dosage forms are present. So, we have lotions, we have ointments, we have creams, we have paste, there is a occurrence of gels as well, we have suppositories and we have transdermal patches. Apart from the things that are mentioned on the screen, I would like to add also poultices or cataplasm. So, these are some of the formulations that are classification of semi-solid dosage form. We have studied about the formulation of each of the semi-solid dosage form in a detailed manner. We are going to understand that after formulating the semi-solid dosage form, what are the different types of evaluation parameters. Now, if I say evaluation, so what does it mean? Evaluation means testing. Testing, why? Because when we have prepared something, we have fabricated something, we have formulated something, it is important for us to understand that how good this formulation is, how good this efficacy is, whether what we have formulated does comply with the standard. For that purpose, it is important for us to understand the evaluation of these substances. So, we are going to study about the evaluation of ointments first. There are 4 major tests that are actually present in order to evaluate the efficacy and potency of ointment. The very first test is the penetration test. Another test is the rate of release of medicaments test. Third test is the absorption of medicaments into the bloodstream test. Eventually, last test is the irritant effect test. So, these are 4 different types of tests which are implied in order to evaluate the suppositories. So, let us understand each and every test in a detailed manner. The very first test is the penetration test. Now, penetration means actually transportation or moving of any substance from the area of applying to the area where it is desired to be penetrated. So, penetration test is actually done in order to understand how much our ointment is actually penetrates the area onto which it is applied. So, for that test, what we do is we take area of the skin and what we do is we eventually apply a certain amount of initially weighed ointment here. For example, we had weighed 5, I am just taking a simple example. For example, we have weighed a 5 gram of ointment and we have applied these ointments on the surface of the skin. After application, we are just leaving this application for a certain period of time, and after certain period of time, what we are going to do is we are again going to evaluate or we are going to scrap the ointment that we have already applied on our skin, and we are going to weigh this ointment again. For example, let us consider a situation if initially the weight of ointment applied was 5 gram. Now, after weighing, this application actually becomes 3 gram. So, can I say 2 gram of ointment has penetrated the skin onto which it is applied? So, here this test help us to understand how much quantity, how much amount of ointment has actually penetrated the area into which it is applied. So, a weighed quantity of ointment is rubbed over skin for a given period of time. Let us say for 1 hour, let us say for 2 hours. So, for a given period of time it has been applied, and unabsorbed ointment is collected and weighed again. Unabsorbed ointment is collected from the area onto which it was applied and it was weighed again. So, the difference in the initially applied ointment and later on applied ointment can be subtracted from each other, and how much quantity of ointment actually penetrates the area can be measured easily. So, this is all about the penetration test and the first test of the evaluation of ointments. Now, next test is the rate of release of medicament test. This test actually help us to understand how much quantity of medicament releases or gets released from the area which it is applied. Basically, this test can be done if the ointment is a medicated ointment, because if it is a placebo ointment which do not contain any API, the release is often difficult to analyze and difficult to understand, because for this purpose we are taking an antimicrobial ointment. For example, for this purpose we are taking a nutrient agar plate or a Petri plate method. For example, if this is a Petri plate and on that we have added our test ointment. We have added our test ointment, and during the addition of test ointment we have also added our culture of suitable microorganism, any microorganism. Now, this test ointment contains antimicrobial substances, or let us say antibacterial substances it contains. Now, if we have applied this ointment here, if this ointment reaches this particular area, it means that up to which extent our ointment is going to release the medicament. If the area of the Petri plate is this much, then and if we are attaching our medicated ointment here, and if it releases, or if the power of the medicated ointment is only up to this area, so it means that this is only the efficacy of our ointment. However, if we are increasing the dose of the ointment and if we are getting the efficacy to entire surface of the Petri plate, so it is easy to understand that the efficacy of our antimicrobial ointment is quite high, because it is going to cover the entire microbial thing. It covers the entire microbes, entire Petri plate. So, this helps us to understand that how far or what is the extent of the release of our medications or the medicaments. So, to understand this, let me read this test as well. To assess the release of medicament, small amount of medicament or ointment is placed on the surface of nutrient agar media. Here I would like to add here one thing. This nutrient agar media consists of a suitable culture of microorganism onto which we are supposed to do the testing. So, previously gasped with S. aureus microbe, that is Staphylococcus aureus. So, here in that nutrient media microbe, in that nutrient plate, we have already added the culture of S. aureus, that is Staphylococcus aureus. Then after a certain period of time, by measuring the zone of inhibition, by simple actually using the scale, by measuring the area up to which that zone of inhibition was done, we can assess the rate of release of medicaments. Then let us move on to the next test of evaluation of ointment, and this test is known as the irritant test. Now, irritation, irritancy, inflammation is something that we do not desire into our product. So, we do not want any product to show irritancy, inflammation or unacceptability, because we are applying creams, ointment to treat the particular area. We do not want the product to reach, or we do not want that product to harm that particular area into which it was applied. So, however, certain medications are present which may actually harm or irritate a particular skin. So, to analyze that whether our ointments contain these products or not, we are undergoing these things, or we are undergoing these tests. So, in general, no semi-solid dosage form must possess irritancy effect. We do not want any semi-solid dosage form to possess any sort of irritancy effect. For that cases, whatever we have formulated, we do perform irritancy test on that. For that purpose, what we do is we apply the test substances onto the skin and eye of any animal, preferably rabbits. So, for that purpose we are supposed to perform animal testing, and we use our product onto these animals, onto the skin area, onto the eye area, because we have to be cautious that if these products are applied onto human, so it may not cause irritancy or inflammation of the eye area or to the skin area. So, for that purpose we perform these tests on these animals as well. Now, after application, what is important here, irritancy effect can also be judged. If you want to judge the irritancy effect in another way, so that can also be judged by injecting the ointment into thigh muscles or abdominal skin of rats. So, for that purpose, we can also judge the this effect by injecting the same ointment into the thigh muscles or into the abdominal veins of this particular animal, like example rats. Or if after injecting or if after applying we find any inflammation, any sort of activity, we have to report into 24, 48, 72 and 96 hours. So, this test is done for certain duration, because it helps us to understand that up to what duration, if we apply these substances for 2 hours, for 10 hours, for 24 hours, so does it produces any sort of inflammation. So, this is a simple test that helps us to analyze the presence of any irritancy factor in our formulation, or if there is a presence of any lesions on cornea, iris, conjunctiva, that can be help us to analyze the presence of any sort of irritancy effect produced by any of our ointment. So, these were some of the tests which were used to evaluate the ointment. Now, moving on to the next sort of semi-solid dosage form, that is creams. So, that there are 3 important tests in order to evaluate the creams. The very first test is the rheology test. Another test is the sensitivity test. Now, the last and the third test is the biological testing test. So, rheology test is a test that is actually performed in order to assess, evaluate the viscosity of our formulation. If the rheology properties of any semi-solid dosage form does not comply with the standard, then there are issues to it. As a result, what happens? Rheology test help us to understand that during manufacture, if the viscosity was certain amount, let us say 25 centipoises, and if after the 2 years of shelf life, whether the viscosity or whether the rheologic properties remains intact or not. So, rheologic testing help us to identify the viscosity, the flow properties, the thickness or the stability of our formulation. Next test is the sensitivity test. Sensitivity test help us to understand, this test is similar to that of your irritancy area test. It also help us to understand that whatever the formulations we are making, is it producing any sort of irritancy, or is it making our skin more sensitive to a particular formulation. So, that also help us to understand the criteria of our formulation. Then the last test of our evaluation of creams is the biological testing, because until and unless our creams or any sort of formulations are biologically tested, it is not safe to be used by humans. Hence, animal testing and clinical trials must be done in order to make any dosage form come into market, because that if not tested properly, there are chances that it may harm to the applicant, it may harm to a user or any consumer. So, as I have discussed already, rheology helps in it is a test that help us to understand the flow properties of the formulation, because through these flow property only it is important for us to understand the evacuation of the creams. Evacuation means usually creams are supplied in a collapsible tube. If into that collapsible tube, through one side you apply pressure and the another side from the other side the creams are being evacuated from the tubes. If the rheological properties or the rheological testing are not done properly, then the evacuation is always a serious problem actually. So, amount or desirable quantity of creams won't come out from the collapsible tube. So, it is important to understand how much quantity is coming out in a particular pressure. So, evacuation of creams is or any sort of ointment is done by rheological testing. Viscosity can also be measured by using viscometer if we want to analyze the presence of viscosity enhancer, if we want to analyze how viscous our preparation was during formulation, after formulation or after its entire shelf life. So, these are some of the tests that is done to evaluate the creams. Another test, as I have said, it is a sensitivity test. It helps us to analyze that whether our product is sensitive or not, is it causing any irritancy, any inflammation, any harm to the area onto which it was applied. This test can be done normally by undergoing a simple patch test. Simply the area certain amount of area, certain part of the skin is applied by using that particular cream. On that particular area, what we are doing is we are initially applying that cream, and we are just leaving that particular area for certain amount of time. After that certain period of time, we analyze that particular area, whether it was affected, whether it was inflamed, or whether it became sensitive to heat, light, to moisture. So this helps us to analyze the sensitivity of our product. Then let us understand the different types or test of evaluation of paste. So, when I talk about paste, it means I am talking about a semi-solid dosage form which has a higher consistency as compared to any other sort of dosage form. So, definitely the test is also quite high as compared to any other dosage form. The test include the rheology test, another test include the foaming character test, pH of the product test, abrasiveness and particle size. So, these are some of the tests that are being done in order to evaluate the paste. Let us move on to the first test, that is the rheology test. Rheology test help us to analyze that how good your product can be evaluated, can be evacuated from a particular collapsible tube. If rheology test, or if the flow property, or if the extrudability, spreadability is not analyzed, then in the later or in during the shelf life of the product, the using of this product might be a challenging task for the consumer. So, evaluation of rheology is a very important factor in order to evaluate paste. Another test is the foaming character test. During the preparation of ointment, during the preparation of creams, I had already said that if the creams are used or if the paste are used for cleansing purposes, it is important for us to understand that whether it produces the desired amount of foam. If yes, then that test has to be done by undergoing or by analyzing the foaming character. If it is a cleansing sort of paste, then foaming character plays an important role. Next test is the pH of the product test. pH of the product plays an important role because if the pH of the product is not maintained, it means that there are certain changes happening in the product. So, suitable buffers are added into the product in order to maintain the pH of the product to entire shelf life. So, example, during formulation the pH of the product was slightly alkaline and we want our product to remain slightly alkaline through entire its shelf life. So, pH of the product remains, or this evaluation parameter remains an important parameter that has to be assessed. Next test is the abrasive test. As I have already discussed, if the formulation or if the fabrication is a toothpaste, we do require presence of abrasiveness in order to impart the cleansing activity. If the abrasiveness is not present, then there are chances that we may not get the desired result that we require, because in toothpaste the presence of abrasiveness or the presence of grittiness is required to enhance the cleansing process or to enhance the teeth. It could be for any other purposes as well. For example, scrubs. So, these scrubs are desirably entitled or embarked by incorporating gritty particles into it, because the main use of scrub is to scrub the area into which it is applied. For that purpose, this test also plays an important role, because abrasiveness eventually leads to cleansing of a particular surface. Next test is the particle size test. Particle size test is an important test because we want our product to remain intact throughout its shelf life. If the particle size of the product does not remains the same, then there are chances that agglomerization has occurred, clots are formed, clubs are formed, lumps are formed. So, definitely that is a completely undesirable phenomena if we talk about paste. So, we do not want formation of any clots, clumps, lumps or any sort of agglomerates. Hence, particle size has to be analyzed, has to be kept in mind while formulating the semi-solids. Now, let us understand the different parameters that are used in order to evaluate the gels. So, if I say gels, so gels means it is a semi-solid dosage form that usually contain aqueous or hydrocolloid substances in a higher quantity. So, gels the evaluation parameters of gels are also different as compared to any other substances. The very first phenomena is the drug content, the next phenomena is the homogeneity, another phenomena is the pH of the product or by measuring the pH of the product, next is viscosity, another phenomena is the spreadability, and eventually we have the extrudability of the product. Each and every test that is being mentioned here plays a very important role that help us to analyze the product, that is gels evaluation, basically to understand the efficacy of our gel. The very first test is the drug content. Now, drug content is a simple test that help us to analyze that whether or during formulation the quantity of the drug which was incorporated into it has not lost during its course of time. We do not want that a product actually loses its efficacy during its course of time. We want that whenever the product was manufactured and during its shelf life, the product remains intact. As a result, drug content is analyzed. In order to analyze the drug content, we usually perform the release of medicament by through the dissolution apparatus at regular interval of time. Aliquots are taken. These aliquots are examined under UV spectrophotometer, and these spectrophotometer takes the absorbance through which we can understand the concentration of our product at particular drug at particular interval, which help us to analyze the presence of drug content throughout the shelf life. And thus this test is an estimation of efficacy of our product, and it is a very important and vital test. Another evaluation test is the homogeneity. Homogeneity means that whether our gel that was initially formulated does not break or does not get segregated or separated during its course of time. If the gel was initially a hydrophilic aqueous colloidal substances, then it should remain in that state even during its shelf life. We do not want that it changes its state or gets converted into another state during its course of life. So, homogeneity help us to understand the single phase of the product. Next, an important test is a pH measurement test. As I have already discussed, pH during formulation must remain same, and after the formulation also must remain same, as well as during the course of time. It should not happen like during of course of time the formulation must lose its pH. As a result, suitable buffers are added into the gel so that the pH of the particular gel remains intact through its entire shelf life. Then later on we have another test known as viscosity. Viscosity is an important test because viscosity actually makes a preparation. If the viscosity is of optimum range, it is going to make a preparation semi-solid in nature. If a formulation loses its viscosity, it is definitely going to get converted into liquid dosage form, which is not the actual character of a gel. Hence, an optimum viscosity must be attained by a gel. This viscosity testing can be performed at regular intervals by using a suitable viscometer, for example, Oswald viscometer, for example, Brookfield viscometer. So, there are many in markets through which we can assess and test the viscosity of our formulation. Now, next evaluation parameter is the spreadability. Spreadability is a character, or it is an test or a phenomena which help us to analyze how or up to which area, up to which extent our substances are, up to which extent our formulation is going to spread. So, this is an important test which is going to impart the which is going to help us to understand the presence of spreadability. Then last is the extrudability. Extrudability help us to understand that at what extent, in what concentration the substance is going to come out of the containers in which it is stored. So, extrudability and spreadability are also two very important tests that has to be done while evaluating the gels. Then this was all about the evaluation parameters of gels. As a result, because when we formulate any semi-solid dosage form, the efficacy, the potency of the product has to be done carefully while formulating. So, these evaluation parameters help us to understand that whatever products we have manufactured, yes, it does complies with the standard. So, I have covered entire evaluation parameters of semi-solid dosage form. I hope this lecture was very informative for all of you. Thank you so much.